Can you tell us a little bit about how the first human trial work of isoniazid unfolded at Seaview Hospital and what role the Black nurses were playing, and a little bit about that archival research that you did to write the book?
Yeah, that's a great question. So in 1951, so Seaview Hospital was a hospital that had men, women, and it was one of the few that had children, a children's hospital. It actually had a maternity ward, so people gave birth there. So you had from 0 all the way up to whatever age, 70. And it was a hospital that also had all different ethnicities and races. So, and all different types of tuberculosis. So it was a great place to be able to do trials because they could test the drugs on different types of TB. Most of the TB drugs were tested on pulmonary tuberculosis because that was the most common type. So in 1951, in May, Dr. Selikoff, who was Dr. Robotchek's partner, received a call from Hoffman LaRoche that said, hey, you know this drug that we've been testing on guinea pigs and on mice, it's showing promise. Do you want to test it on humans? Yes. So in 2 days, they got the okay to go ahead from the head of the hospital, the president, Dr. Orenstein. And they put together a trial of 5 patients. There were 3 women and 2 men. These were called lungers. That's what they used to call themselves, terminal patients. They had been in and out of Seaview. And the criteria was death had to be imminent and no other, like everything else had failed. So streptomycin had failed, operations had failed. So these 5 patients were approached and said, listen, you're dying, essentially, but we have the possibility of this drug. And they agreed, they consented. And I just want to make sure of that because I know there's some information floating out there. This was a Tuskegee kind of experiment. It wasn't. He got consent from all of them. I know this because I spoke to 2 of them that had been part of this trial. So they said yes. And he set up this initial 5-person trial, having no idea how to titrate the medication. All his information had come from mice and guinea pigs. So he began to titrate it based on kilograms. And the nurses were the ones administering the medication. Now, the nurses had been working there for decades. They knew these patients, they knew the disease, they knew its nuances, how it ebbed and flowed. They knew how how wily and stealth the microbe is, how in an instant somebody can wake up in the morning and be fine and then they're hemorrhaging. And so in addition to just taking the vitals, they were tracking the patient's emotional, mental, and physical, what was going on with them when they were giving them medication. That worked. They stopped it for 6 weeks. There were no toxic side effects. And then they started up with 92 patients. And that's what became the initial trial. So they split men and women into 2 wards, and it was up to these nurses. And at the end of the day, Robotchek would come, he'd collate their notes, he'd go down, he'd collect them, collate them. And that's how they started to see, oh, well, look, INH at this dosage is creating dizziness or a ringing in the ear. But it was all based on the nurse's notes. And I always say there's one moment where you can see how astute and meticulous they were. They started to notice that people's legs were twitching in their sleep. And so these people were anorexic. So, they slept under lots and lots of blankets. So imagine being able to notice that, they did, because they knew these patients and they knew what was normal for TB and what wasn't. And that is how the trials began to, that's how they started to get all this information. And, his papers, his son gave me all the archives, and you can look at, they're handwritten papers. They look like Excel spreadsheets. And he's got all the medication and how he begins to increase it or decrease it. And it's pretty fascinating stuff.